And now to discuss the latest about COVID-19 in the province of Ontario, I'm joined by our Member of Provincial Parliament, Jim McDonell. Welcome, Jim.
Good morning.
All right, so the Ontario government has announced the creation of an Ontario Jobs Recovery Committee. So let's talk a little bit about what their function will be in terms of bracing for the economic impact of COVID-19.
Well, we all know that this virus has created a huge impact on our economy. We have over 400,000 people in Ontario who've lost their jobs in the last month. So we're looking at something to get the on the ground running. We have some people that are we've pulled in industry experts to look at what we need to do to make sure that we can look back in a number of years and after a full recovery of this economy, because if we want to maintain our standard of living, keep up our services, we have to get the economy going.
And we know obviously that the economy and jobs were a focus of the government even before this, but throughout this crisis, the Premier has certainly touted Ontario's capacity for manufacturing, both in terms of essential items that we need. So maybe touch on that a little bit.
Well, we're converting a lot of our manufacturing lines over to ventilators. We heard some news about some new testing capabilities, but those products have to be built, and the demand around the world is huge. So, Ontario has always been known as Canada's manufacturing hub. So that should place us in good stead for that part of the recovery. But the recovery is going to be really province-wide if we're going to see a big impact and the ability to jump back and get to some form of normal over the next number of months.
And you mentioned testing capacity. We know, of course, last week we spoke about it, how Premier Ford has certainly been adamant about increasing the number of tests. I believe the numbers we're looking at now is by this week, 8,000 a day, up to 16,000 a day by May.
I know testing is top of mind, and we look at a lot of countries that have done a lot of testing. We're trying to focus on of course, our seniors' homes and our healthcare workers. The logistics of that are very difficult, as you have to actually be there, visit these locations. So it has I would think, an impact on the numbers. But as we open it up to other groups, that'll enable us, through some of the assessment centers to drive these numbers up. We want to know just how many people have the virus, and how many we're actually working with this, and compare us to other locations around the world to see how their stats are working and how they've recovered. And all this is great information, and the more information and data we have, the better decisions we can make.
And we know just how important that testing is. When we look, of course, right now we're averaging about 400 new cases a day. And unfortunately, we've seen some outbreaks and deaths at long-term care homes. So we know that part of the testing is going to be targeting healthcare workers and long-term care homes, correct?
Yeah, and the long-term care is, it's our hearts go out to the deaths of the families, but it's a very difficult situation as you're looking at our most vulnerable population, all in one location. So it's hard to keep the viruses out when it's it's an invisible virus. You don't know who has it. You get healthcare workers doing their best to try to isolate, but it's a very difficult task, if not impossible. So we're working through it. Better testing capabilities. We're hearing about tests that will be done as quickly as 5 minutes coming up. I mean, those type of things will be game changers, and will allow us to isolate people before they actually go on shift. But right now, that's not a possibility.
And just finally, the province has also started a portal for to match volunteers with those most in need, the Spark website. So I'll get your thought. Talk a little bit about that.
Well, that's been a bit of a good news story. We've had many people come through our portal for volunteering. People that have retired from the medical field, or we have new doctors coming into the country that haven't been able to practice, nurses. So it's an opportunity for people that that can help, want to help, and then the portal actually matches up requirements for qualifications. So it's a great opportunity for people to go in, and of course, those the portal is available through ontario.ca, so we encourage people to go on, and if you have a skill, or a lot of it's just medical experience, taking information, there's a lot of different jobs that are available for people that have the time, have the experience, and would like to get involved.
On that note, MPP, I'd like to thank you once again for joining me for this Ontario COVID-19 update.